Today we chat with Salmin. Ivan is a clinical psychologist who works in the private practice, as well as a senior clinician and program coordinator at Touchstone. That's a CAMS therapeutic day treatment program for young people with emerging borderline personality disorder who frequently struggle with emotional dysregulation, self-harm and suicidal behaviour. Ivan is a clinician with extensive experience of working with adolescents and their families in the complex areas of mental health related to childhood trauma, adolescent eating disorders, self-harm and suicide. This is the first of two podcasts chatting with Ivan. So Ivan, what are the main causes of mental health issues among young people?
That's a very important question because mental health issues are they much more complex than we might think about them, just especially if we're thinking about the different conditions and different diagnosable disorders. And when we're thinking about the mental health issues, I think as a professionals we learn to consider many different factors. And some of them, as maybe you're familiar, the people considered for years what is its nature or is its nurture that impacts on us the most. And I think at this moment there is not discussion anymore around this. It's both. It's nature, the biological factors and the genetic predisposition. We know that some of the conditions are run within the families, and so therefore genetic vulnerabilities are important to consider. We often in our work with young people, and I'm working mainly with young people and their families, we explore initially, just what happened in the immediate family and extended family. And often we see, for example, if anxiety or depression runs on one side or on both sides, that there is most likely that it can be revealed itself in a young person that we meeting with. So, and we're talking about the genetic and biological factors, but also we thinking about the social and environmental factors, and it's family and environment of upbringing, the parenting style, because we know, just every family and all parents are very different, and we often focus on what kind of connection the parents have with the child. We call it attachment style, because depending on the ways the parents or the particular mothers interact with the child from the day they're born, they form certain patterns, how they interact and how they able to co-regulate emotionally and later self-regulate emotionally as well. And I can focus a little bit more in details on this. But also then we talking about on childhood experiences for a young person, just in terms of the environment and starting from the kindergarten and then the school, what the experiences being. We're focusing on any traumatic experiences, or for example, bullying or any form of abuse at home or at school. And we're talking about physical abuse, we're talking about sexual abuse, and we're talking about emotional abuse. They all play in quite big part. And of course, at this time and this age, we probably cannot avoid the role of media and internet and social media in particular, because if, for example, 10, 15, 20 years ago, it was not present in our life and there was no really significant role, that here now we hearing more and more about the impact of online bullying or the different situations that really impact quite heavily on young people. And again, we're talking about all these factors, but it's not any one particular of them in isolation that there is more important than other. It's just a combination of these factors. Often we see them as this forming of perfect storm, just for the person to cope well and to deal well, and suddenly to feel that it's become too much and it's overloading, and suddenly the things go in completely different way, and they start to really struggle in a big way and start to feel overwhelmed. And of course, That's the factors that I already mentioned, but it's impossible to avoid the very important one, especially if we're talking about young people. It's actually adolescence and time of adolescence and adolescent brain, because adolescent is a very particular time of life, and there is a number of things happens during this time. There is a lots of changes. I mean, when people hit puberty, and it's coincided with going from primary school to high school, which is big adjustments in life. Sometimes people have been in a small school, which is 300 people, all school 2 years in the primary school, and suddenly they move, and the whole 1 year is 350 people. My children went through Churchlands Senior High, and I think in the first year there was 350 people. So it's just in 1 year. So it's a huge adjustment, and of course, then for the first time in life, that people start to develop more abstract thinking. It means they're asking, okay, who am I and where I belong to? And it's, again, the sense of belonging and being part of the group, being included or excluded from the group. It's a kind of quite difficult task to negotiate, especially when you transition into a new school and you don't have maybe friends, the same group of friends, or the group of friends that you knew suddenly disappears, and everybody's trying to find the new connections and a new sense of belonging within the group. And it's also happening at the time when we, with puberty, lots of physical changes. You know, the bodies start to change, and the hormonal changes, and suddenly your emotions are all up and down, and you feel that the stability that you had until then is gone, and suddenly you're in this completely new territory, and everything is destabilized. And I think it impacts on lots of young people, and they feel lost. And of course, we're talking about also adolescent brain structure, because the areas of the brain, when we consider an adult person, are usually responsible for the emotional processing and emotional regulation. We're talking about the frontal lobe and prefrontal cortex, and that's part of the brain that fully formed only by the age of 25. So when we're talking about adolescence, it's not fully formed yet, and so therefore it's the emotional regulation. You know, the relies on a much older brain structures, on a limbic system, and a part of it, the little part, almost of the size of the almond, it's called amygdala, and this part of the brain is responsible for the primary reactions evolutionarily developed, which is kind of like well-known fight or flight. So, and they usually designed to help us to survive in the world, and they program to respond to if we facing something threatening or with something that we fear. So that these responses, and they're quite powerful, these responses.
So it's fair to say that that part of the brain is still developing until the age of 25?
The prefrontal cortex, yes, it's continuing developing, and I think it's fully matured at the age of 25. And this part of the brain is really working as if we drawing the parallel with a car, it's a brake pedal, it's a braking mechanism. So therefore, it doesn't mean that it's absent, but it's not fully matured yet. So therefore, until this age, and that's therefore maybe currently there is lots of programs that working with adolescents and the youth are from the age of 12 to 24, 25, that it's extended, because only then I think the people start to really move into different territory when they kind of a little bit more feel in control of the emotions. And I can fully relate to this, because among my children, I have 21 years old, 23 years old, and 25 years old, and they're quite different journeys in their lives, you know.
So what are the most common mental health conditions?
Well, I think in my work in the clinical psychology, with the training and the preparation, and I think with experience, most commonly we see young people who presented with anxiety in the different shapes and forms, and anxiety can take forms of just generalized anxiety or social anxiety. That it could be, taking form of phobias, and we know the different forms of phobias. So if people fears of spiders or enclosed spaces, or heights, or the when we're talking about OCD is also part of the anxiety condition, because people have this fears of often contamination or other things, and which is accompanied by different rituals as well, and different types of repetitive behavior, and they feel that they are obliged or have to do certain rituals to actually feel safe or feel that they can avoid whatever the fear, the object of their fear is. And then, of course, we're talking about presentation with depression, and often there is an overlap between anxiety and the depression, and there is a quite big, and when we're talking about professionally, then we're talking about that anxiety often precedes depression as well. And we see the early onset of anxiety, or even from the very beginning, the parents can report that they've always been anxious child, from the day one. And then when we're talking about the different types of depression, it could be depression as a reactive to some event in life, or we also can see young people presenting to quite long and entrenched kind of like the severe depressive episodes. But sometimes people just experience the lesser probably intensity of depression. We're talking about a different presentation. I spent many years in the eating disorder unit, so the eating disorder is a very common condition within the mental health presentation. And when we're talking about eating disorder, it's not one particular, because people know about anorexia, but when we're talking about eating disorder, it's a spectrum. So it's many different condition can be. It's the we know anorexia, we know bulimia, but there is binge eating condition. There is selective eating, and eating disorder most of the time not otherwise specified. So it's kind of, there is lots of disordered eating, but not necessarily fitting the whole criteria to qualify as anorexia or bulimia as such. And so there is a lots of kind of like overlap, because if we're talking about eating disorder, which I have kind of like, that's probably my areas of expertise, there is underlying anxiety and depression is very common as well for presentation for eating disorder. Yeah, so that's probably the most common conditions that we see among young people.
Are there any patterns that you see as a clinician in the development of mental health and particular age groups?
Kate, I think if we are talking about presentations, that I know that among adolescents, most of the time, people start to present to CAMS, the Child and Adolescent Mental Health Clinics, probably around 13, 14 years of age, but again, it doesn't mean that that's where the conditions start to develop. I mean, if we're talking about anxiety, for example, but I think, and if we're talking about some genetic predisposition and loading, that it would be present from the very beginning of the child's life. It's maybe not necessarily will be revealing itself in a form of like the anxiety, but the parents can identify some kind of forms of presentation. And anxious child might be more fidgety and more active, more quite unsettled. And we also can see sometimes somatic presentation of anxiety, which is not displayed in a clear form, but more sometimes displayed as a young person maybe complained on headaches or sleeplessness, just the disturbed sleep pattern, or pain and aches in their body. But again, it could be probably revealed itself through different types of behavior, and not necessarily is identified as anxiety, and maybe only later in life when it starts to impact on the I don't know, relationships, on the studies, on the academic achievements, then the parents start to pay attention, or maybe teachers start to pay attention, and then when it comes to attention of the professionals. So it's have to take certain kind of like, I guess, building up before it comes. And maybe some people, as I discussed it from the very beginning, it's interactions between the genetics and the life experiences, because now we have this concept of epigenetics. And epigenetics, we all born with a certain genetic code, but depending on our life experiences, what happens, the certain genes are activated or deactivated as we go. So therefore, again, as I said, it's not the dispute anymore between what is more important, nature or nurture. It's both, and it's an interactive system in us. And probably depending, if we take two the same people, maybe with this, similar patterns of genetic predisposition for anxiety, but the different life experiences, they would have, by the age of 13, 14, would have a completely different presentations formed. And one maybe would be able to cope well and have enough support and understanding in their family or in the environment, and another person maybe will have completely different presentation, because they wouldn't have certain element in place that would enable them to deal with these internal maybe struggles and external struggles in the same time.
Super interesting. I'd never heard of that before. Epigenetics.
Epigenetics. I think it's quite recent discovery. We're talking about epigenetics probably in the past 10, maybe 15 years, and it's brought lots of light to our work. And as again, we're looking at any mental health issues as a complex interactions of different factors. And as I said, just depending on what happened in a person's life. Because if we're talking about the experience of sexual abuse, depending on what age, that they would reveal themselves kind of like in a behavioral patterns, or maybe later, as we saying, just the puberty and adolescence associated with a new stage of cognitive development. The first time in the child's life, abstract thinking, and it's first time in the child's life, the young person start to think, okay, not fully identifying themselves with the parents, which is before the age of 12 approximately. It's almost like I'm at the center of the universe, and I'm fully identifying with my mom and dad. And from the 12, approximately from the age of 11, 12, 13, there is the first time the young person starts to develop the view themselves as a one of many, and there is first time questions start to pop in their head, and who am I, separately and different from my parents. And it brings the new dynamics in their lives. They try to separate themselves from the parents and attach themselves for the first time to the friends group, to find their own identity and sense of belonging. But it has to be their own and different from how they identify themselves with the parents to start with. And of course, through the puberty experience and the different changes, then there is lots of patterns, and maybe inherited patterns start to come through. And we're talking about maybe if depression wasn't present in the person's life, suddenly it might be activated with the onset of puberty as well. So we can see there is a lot of things maybe activated or brought on a different level during the adolescence. Add to this, again, as I said, the eating disorder, for example, it's an area of my expertise. And if we're talking about eating disorder, that's also the time when you start to think about yourself, and you start to compare yourself to your peers. And you compare yourself on a different levels, and including how you look, how your body image comes to attention straight away, particularly for girls. And they start to focusing on what they eat, and they start to maybe just to see what other people doing this. So there is lots of peer, I guess, attention and the media attention on this as well. So the things that they didn't pay attention before, and it's maybe not in the area of interest, suddenly become quite important to a young person. And if we're talking about eating disorder, again, it requires the number of factors to create this perfect storm. And usually we see, okay, all factors together exist, but it's needed one important step. Dieting, engaging in a dieting would create and maybe trigger the slide into disordered eating, and then maybe trigger the onset of the eating disorder for the first time.
So say someone presents to you with a mental health problem, where does suicide and self-harm fit in?
That's a very important question, Kate. I think we consider as a self-harm and suicidal behavior as at the extreme end of the mental health presentation, and I think often what we need to consider and keep in mind that it's can be hidden. And I think when we talking about self-harm and suicide, we need to probably imagine there's an iceberg and the tip of the iceberg. So what the young people who present and being able to talk about this and to talk about the experience, or maybe just to display the self-harming behavior is the tip of the iceberg, and the majority of the people are unknown and never come to healthcare practitioners. And I think for a number of reasons, and it's due to, first of all, I guess, stigma attached to it, stigma to mental health in general, because it's a much easier and much clearer situation if you have broken arm, which my son had on a number of occasions, being the skateboarder, and then or if you have some kind of condition with your liver or diabetes or something, even when we're talking about the cancer, because it can be revealed by test, it can be diagnosed and shown on an X-ray. Mental health has completely different, I think, view in a community, in a society in general, and often I don't think it's clearly understood, and so therefore the stigma is there for the parents, for the young people to present, and then particularly then talking about self-harm, because they're worried about being judged or being totally misunderstood, or maybe thinking that it's attention-seeking behavior that they engage in, which is totally non-true. And it's the same with the suicidal behavior as well. So that there is majority of young people don't talk about this and don't present to health practitioners with these issues. And majority of young people that I'm working with, unless you probe and unless you ask the questions, would not share this with you. And I work with young people who often wear this mask on the outside that everything is okay, everything is fine. And I think it's for the factors that I just explained, but also they don't want to be a burden to anyone. They, lots of young people that I'm working with, thinking that their problems insignificant compared to others. It's a quite interesting phenomena. They would see identical problem in somebody else and would really thinking that it's serious enough, and they would care for them. But having exactly the same problems, they would think about themselves as no, it's not big problem to share with people. And also, as I said, they don't want to be a burden to the parents, to their families, and to the other adults in their life, and to their friends as well, so that they don't talk about this and they wear this mask of happiness and really just what is not true, what's happening and hidden underneath of it.
As far as youth-specific risk factors go, is there anything else you'd like to discuss?
I think there is some factors can be identified as risk factors for the self-harming behavior among young people, and it's if there is a restricted educational achievement, and if there is a family history of self-harm or suicidal behavior. I think it's young people more prone to engage in this kind of mechanism of coping or self-regulating. And also parental separation or divorce or death in the family at the time of person's lives, they quite can be considered as risk factors. And also poor family relationships. As I mentioned, the family is very important part of the person's life, in any person's life. And if the relationships are good, the family can be used as a resource when the person is struggling, so that they don't struggle on their own. But if the relationships are not good in the family, then it's not only become unhelpful, but it can be actually additional risk factor that contributes to the struggle and agony, and just to really to the situation to take some drastic steps, and just to we're talking about at this moment self-harming, but it's very similar to suicidal behavior as well, to take this one extra step when you feel totally isolated and not understood. I only recently, because I in my work I do individual therapy, but I do family therapy as well. And in my last session with the family, and it was the first session, we have the family who don't really understand what's going on with a young person who is struggling. And one of the siblings saying, well, you just all making it up, and you all just, it's your choice to act and to behave like this. And it's quite invalidating for the young person who is struggling in a big way. When the brother or sister saying, well, look, you all just playing everybody up. So it's quite creating extra painful experience, and it can push this person who is already maybe limited on the resources, just to take this extra step and to do something quite drastic in their life. And then we often see that there is people taking overdoses, just by using pharmaceuticals or prescribed medications, or they quite severely self-harm as well. If we focus on suicidal behavior, that there is a prevalence of mental disorder in adolescents who die by suicide is very similar to that seen in adolescents patients with self-harm. So it's kind of, there is a parallel with it. And also risk factors for completed suicide in children and adolescents share many similarities with those with self-harm, who present self-harm. So therefore, we can talk about parallel and the similar factors that I mentioned before are applicable if we take into consideration the risk of suicide. And for example, also presence of an affective disorder for a young person, the level of impulsivity. And that's why when I'm engaging with young people with emergent personality disorder, and impulsive behavior is a part of their presentation, because they unable to regulate their emotions very well. And impulsivity often can lead for them to take this, again, big step or drastic step when they upset and they're unable to calm down in a quite aroused state. So the impulsivity is something to consider. Substance abuse, alcohol and drug misuse, and more than 25% would have personality disorder. So it's a quarter of the population who may be at the threat of suicidal behavior or committing suicide. And psychological, psychosocial stresses as relationships problems, and it's a frequent precipitant for adolescents to completing suicide. And social media, as I said, online chats, growing number of pro-suicide websites, because some of them go as far as can encourage suicide pacts among adolescents, which is quite horrible if you think about this, just what can be found, because we can see pro-self-harm websites now, pro-suicide websites, pro-eating disorder and anorexia websites. There is lots of helpful that can be found on the internet, and I hope in this podcast that I can share some of the resources that can be used, online resources for young people to find this help and support and to break this isolation. But there is lots of unhelpful sites as well. So I think it's for health professionals need to be aware of this and also engage young people when in their contact with young people in education. And so just to warn, that it can be unhelpful. But also we're talking about social contagion, just if you go on this online and you can see that lots of young people engage in this type of behavior, it's kind of like, in a way, normalize it as well. So, and you're thinking, well, that it's just the way, or it opens for you the repertoire that you maybe haven't thought about this before, but now you're thinking, like, why not to try and just see what would be the outcome of this.